Hey you guys, it's Karen Tays again, and I'm going to speak on the urban legend of will you swallow your tongue if you have a seizure. Because of my medical background, I'm going to speak on this topic. Okay. Because of my background, I'm going to speak on the urban legend or myth that you could swallow your tongue if you have a seizure. I don't want to make light of people that have seizure disorders or seizures themselves. I just hope to shed some light on maybe seizures and the anatomy of the airway. Have you ever seen a seizure? If you have, you've probably thrown out some OLJs. And for those of you who don't work EMS, OLJ stands for Oh Lordy Jesus. Every time we pull up on a seizures call and go into the scene, usually the family members are screaming out, "Oh Lordy Jesuses." So the second thing they say is, quick, let's put something in their mouth so that they don't swallow their tongue, which usually brings a chuckle to the callous DMS worker, because we know that that's not such a thing. So let's talk a little bit about seizures. I just want to expand a little bit on everybody's knowledge on what exactly goes on when a seizure is happening. There are a number of reasons why people have seizures. They have a brain disorder or possibly a bleed in the brain. There's even a cardiac seizure, or something such as a fever can cause a seizure. Seizures can last from a few seconds to status epilepticus, which means that the seizure will continue unless intervention is made, such as medications and that sort of thing. Seizures are often a sudden onset of involuntary muscle contractions due to abnormal firing of the brain. A seizure can be as subtle as just a numbness to a body part, or one localized body part uncontrollably moving, loss of memory, short-term or long-term, or a full clonic-tonic seizure, which the whole body and all the muscles contract at once. Symptoms are experienced depending on where the disorder or the firing or electrical disturbance in the brain is located. Grand mal seizures are the most common type seizures. That is the clonic-tonic seizures that most people see, where the whole body is involved. This is the one where people assume that they're going to swallow their tongues. After a heavy seizure attack, the body goes into a recovery mode where the brain and the muscles are in recovery. By the way, this is called the postictal state. The body also has a short-term memory loss usually, so the person having the seizure doesn't recall what happened. In some cases, the seizure is preceded, this is just a little tidbit, preceded by different kind of sensations, things like sparking, flashing, a discharge of a smell or a taste, such as alcohol, even like a strange gastric sensation, and this is usually caused in aura. So a lot of patients or a lot of people that have seizures know that they're going to have a seizure because of their aura. This is usually called a warning sensation. So let's touch on the tongue a little bit. Now the tongue is a muscle, a very muscular organ that lies in the mouth. It is primarily the organ of taste. It also is very important in the formation of speech, as well as chewing and swallowing food. They say it's the strongest muscle in the body. So of course, it being a muscle and seizure activity causing muscular stiffening and discharging, of course the tongue is going to be affected. The tongue is attached to the lower jaw and in the rear to the hyoid bone, which is a small U-shaped bone that lies in the back of the throat, just above the larynx. So, in fact, the whole tongue is firmly anchored to the bottom of your mouth, so there's no way you could swallow it, not even if you tried. With all that being said, you must know that the tongue does play a significant role in a person that's had a seizure. Once they're in that post-ictal state, where their body's in recovery, if they're in a certain position that allows their tongue to drop to the back of their throat, it actually can occlude their airway, causing them to not be able to breathe. And the post-ictal state can last from a few seconds to a few minutes, maybe even an hour or two. Therefore, if their airway is not opened, this person is not going to breathe, and if left continuously like that, they're going to die. So, recommendations from an EMS perspective to bystanders, if you witness a patient having a seizure, would be to move all the objects that could possibly cause further injury to them if they should hit them. Let the seizure run its course. Of course, we call 911. And if you want to get a good laugh from the EMS providers, ask them if the patient has swallowed their tongue. And that's it. Thank you.